Heart failure is a leading cause of death in the US. Asian Americans constitutes approximately 7.2% of the US population and are the fastest growing racial ethnic community. At the same time, the current evidence on the burdens of heart failure in Asian American populations, especially Asian American subpopulations, is limited and inconsistent. The objective of this study was to assess and compare the incidence and prevalence of heart failure in Asian American subgroups. We did the incidence and prevalence analysis using the Cerner real-world database. We had a fairly large sample size. For the incidence analysis, the sample size was 6.8 million. And for the prevalence analysis, the prevalence was 13 million. So using the 2015 population as the standard, we analyzed the age and sex standard heart failure incidences in Southeast Asian, South Asian, East Asian, and we also compared these rates with the white patients and Black patients. What we found is that the disparities between Southeast and East Asian patients were larger than those between Black and white patients, with the estimates in the Southeast Asian patients being similar to those of Black patients.
Cardiovascular disease is the second leading cause of death among Asian Americans. Given the broad diversity of socioeconomic and sociocultural backgrounds of the Asian American communities, it's crucial to examine the disparities in heart failure incidence and prevalence among different ethnic subgroups. The clinical implication of our study is that risk assessment and diagnostic decisions relating to heart failure should not regard Asian Americans as a monolithic group, but instead consider individual ethnicities and their respective cardiovascular risk factors. This study also raises concern for under-recognition and under-screening of cardiovascular diseases at earlier stages that would support prevention of cardiovascular disease and heart failure. First, our results highlight the importance of disaggregating Asian American health data. This work was exploratory in terms of assessing the availability of ethnicity level information in EHR data that can provide a wealth of information. Most of the data is not collected in a disaggregated format. And so one major policy change would be to standardize systems of race and ethnicity standards, perhaps matching the new federal standards, so that we can have actual meaningful research going forward. Community engagement is also really important for Asian American health equity research. Trying to understand the upstream factors for cardiovascular disease is crucial. And last, it's really important to support expanded research funding for Asian American health research, because so much of these disparities are invisible and there's limited funding. It's hard to make the disparities apparent and also attract interest for research funding. So I think it's really important to try to break that cycle and increase that funding to be able to grow meaningful research.
So one thing I want to add is AI is propelling precision medicine forward. Race and ethnicity data often used as surrogates for genetic makeup or SDOH, which can sometimes cause more biases. For example, without nuanced data, an AI system can mistakenly underestimate or overestimate heart failure risks for some subgroups, which can then lead to less optimal treatment decisions. To have trustworthy and fair AI, we should need more nuanced data.